Shoulder pain is a common problem that can affect you at any age. Your shoulder is formed by three bones that come together. These bones are your shoulder blade, or scapula, your collarbone, or clavicle, and the bone of your upper arm, which is called the humerus. Several tendons make up your rotator cuff. These tendons are attached to muscles in your back and shoulder. The tendons are also attached to the top of your humerus to help keep it in your shoulder socket. Tendinitis happens when your tendon gets inflamed. Injuries, infections, diabetes, and inflammation caused by rheumatoid arthritis can all cause rotator cuff tendinitis. However, it's usually caused by long-term repeated use from things like swimming or throwing a ball. The chance of getting rotator cuff tendinitis also increases with age. Symptoms. Some of the symptoms you might get with rotator cuff tendinitis include pain in your shoulder, sudden or increased pain with activity, decreased ability to move your shoulder, and weakness in your shoulder. To diagnose your problem, your provider will look for areas of tenderness and check your shoulder movement and strength. Your provider might take a sample of the fluid from your shoulder or do blood tests. These tests can help find problems like infections. If your pain doesn't go away with treatment, you might be sent for imaging scans, which may include an ultrasound or an MRI scan. Treatment. The first step in treating tendinitis is RICE. It stands for rest, ice, compression, and elevation. RICE is part of the treatment for rotator cuff tendinitis. Rest means just that. Try to avoid using your shoulder, and apply an ice pack for 15 to 20 minutes, several times a day, for the first couple of days to help relieve pain and swelling. Wrap your shoulder with an elastic bandage to help reduce swelling and keep your arm and shoulder propped up while applying ice. Your provider might recommend non-steroidal anti-inflammatory drugs, or NSAIDs. Many of these are available without a prescription. Naproxen, ibuprofen, and aspirin are examples of NSAIDs. As your shoulder gets better, you might be given light stretches and exercises to do. Your provider might send you to a physical therapist for help with this. If you continue to have pain, a steroid injection into your shoulder might help. If these treatments don't help, you may need surgery. To avoid getting rotator cuff tendinitis, stretch and warm up before you exercise, and increase your activity levels slowly if you're doing repetitive tasks.